I'm Jesusa Helaratne, Deputy Director of the Multicultural Health Communication Service. I'm your moderator for today and for these sessions, and we thank you for joining us. Today, we're so glad to have back with us Dr. Jan Fizzell, our New South Wales Senior Medical Advisor, joining us online as she has to self-isolate, but we're glad that she's here. She'll be answering your questions on COVID-19, flu, and other public health issues. As this week is Donate Life Week, we have joining us this afternoon donation specialist, medical and senior staff specialist, Director of Fairfield Hospital, Dr. Ramanathan Lakshmanan, and Organ and Tissue Donation Service General Manager Daniel Fisher, to speak about the key messages of the week. Dr. Ram is joining us online as well, and Danielle is with us here in the studio. Hello. We would like to begin by acknowledging the traditional owners of the land from which we are all meeting from today. We pay respects to elders, past and present and emerging, and acknowledge the traditional custodians of the land of the Camaragal people of the Guringai tribe of the Eora Nation. We also pay respects to leaders and multicultural elders who are represented in this session today. As always, we want to thank you for keeping your microphones on mute. As we only have 30 minutes, we'd like to ask you to please ask your questions on the chat, give us your thoughts, and make sure that we have a lively discussion for this afternoon. Throughout the session, my colleagues from the Multicultural Health Communication Service will be putting some links on the chat on COVID-19 and other health issues, and on donation, organ and tissue donation topics for you to use for your publications and to share with your community. But for now, we'll pass it on to Dr. Jan for COVID-19 updates and flu updates. Dr. Jan, how are you?
Well, thank you, Jess, and good afternoon, everyone. In the last 24 hours, New South Wales has seen just over 16,000 positive test results, either by PCR or by rapid antigen tests. We have seen an upswing in the number of cases and the positivity rate of those people who are going for PCR testing. So COVID is well and truly with us in our community at the moment. Over 2,275 people have been hospitalised at the moment, with 56 in ICU, with 14 on ventilators. So COVID remains with it. It remains a serious illness, and it's really important that we keep doing those little things to keep us COVID safe and to wear through winter well. So please, booster vaccinations remain so important and so accessible. It's very easy to find a local vaccination provider, either in your pharmacy, GP, or one of the New South Wales Health vaccination centres. Just have a look online. Please make sure you stay home if you're unwell, and if you are leaving that, and if you are unwell, do a test. And of course, if you're going outside, please make sure you wear a mask when you're around other people, particularly indoors in crowded spaces. And if you can, get together as a family outdoors, and think about doing a wrap before you get together in any large group, just to make sure you don't accidentally take COVID with you to a family gathering.
Thank you so much, Dr. Jan, for your update, and we'll get your answers your questions answered by Dr. Jan in a bit, but we'll now pass it on to Dr. Ram Lakshmanan. I will call him Dr. Ram for any updates, and tell us what are the key issues, key messages for Donate Life Week this week.
Thanks, Jess, for the opportunity. As you rightly mentioned, this is Donate Life Week, the National Awareness Week for Organ and Tissue Donation. With more than 1,700 Australians on transplant waiting lists and another 13,000 on dialysis, some of whom may require transplantation, registering your decision could actually save lives and transform people's lives. It's important to know that your opinion matters and you have a choice. You can register yes to donating all organs and tissues. You can register yes to donating some organs and or tissues, or even a no to donating organs and tissues. It doesn't matter how old you are, your medical history or your lifestyle, or which country you're coming from. You can still register as an organ and tissue donor. You can register as an organ and tissue donor even if you've had COVID. All Australians over the age of 16 are encouraged to register their donation decision on Australian Organ Donor Register and share that decision with the loved ones, because that's what matters. There are lots of myths and misconceptions in the community about organ and tissue donation, which is why events such as today are so important. The media can play a major role in ensuring that the right information is reported and that different communities have access to the facts so that they can make a well-informed decision that is right for them. Part of our role is ensuring that culturally and linguistically diverse communities have access to current, appropriate information about organ and tissue donation and its benefits. This includes various resources developed in language and access to support services at hospitals, including interpreter services where required. Many cultural and faith leaders support organ and tissue donation. Most religious scriptures support organ and tissue donation as an act of charity and goodwill. Donation specialist staff will do everything possible to accommodate cultural and religious beliefs at the time of donation. On a survey about organ transplantation, most people are happy to receive organ transplants. Blood tissue types need to match for the transplant to be successful, and the donors of the same ethnic background as the patients needing transplantation are most likely to be the closest match. Hence, donors are required from all communities and cultures. For more information about donation and transplantation, you could visit donatelife.gov.au. That's the website. And as I said, your opinion matters. You can register your donation decision in just 3 taps on a Medicare app, or visit the Donate Life website and you could register within a minute. Donation is a rare occurrence, and it's a gift of life for a person who may otherwise die. So throughout July and August, we are joining the great registration race to encourage more than 100,000 Australians to register as an organ donor. Let's do it. Ready, set, register. Thanks, Jess.
Thank you so much, Dr. Raman. We have some questions already on the chat, but we want to ask Danielle. Thank you so much for joining us here in studio. What are as Dr. Ram has mentioned, that communities are supportive of organ and tissue donation, but what are the barriers that you've seen from multicultural communities?
I guess we see a few different barriers. The biggest issues really is that multicultural communities and diverse communities in general often have different priorities in life. They may well have recently come from a different country or a different environment, and they're not familiar with our health system, or they've had experiences in the past where they haven't been able to trust a health system in the same way as one may be able to trust the great health system that we have, well, health systems that we have here in Australia. As well as that, there are religious and cultural barriers. People sometimes feel that perhaps, or have questions: does my faith, does my community support organ and tissue donation? Will that be an issue for me if I support organ and tissue donation now? And we find that while most people support organ and tissue donation, often people just have a couple of niggling questions that they want to ask somebody about before they say yes to organ and tissue donation for a loved one. So like Dr. Ram, I really encourage people this week to consider registration on the donatelife.gov.au website or via the Medicare app, 3 taps, but also to reach out and ask a question. If you've got a question, feel free to look on the website or to send your inquiries in. I guess a couple of the other things that we often hear from people are, what if my organs are no good, my lifestyle, I've had a few too many drinks, or I smoke, should I be bothered to register? And to all those people we say, yes, please register. You never know whose life might be saved and who's waiting on that transplant waiting list. So that is really important. And I guess the last myth that I'd really like to address is, some people worry, will the doctor really try and save me if I'm an organ donor? And yes, the doctor will always do, the health team will always do their best to try and save your life. We only ever consider organ donation once it is clear that a person is not going to be able to live on.
Thank you so much, Danielle. A question, here's a questions from SBS Newsroom to everyone. Dr. Ram, how has the COVID-19 pandemic impacted organ donations and in turn, transplant recipients?
The COVID-19 pandemic, as you all know, has impacted most services, and organ donation is not immune to it, put it that way. So we had so much need for ICU beds that we couldn't support, and staffing as well. We couldn't. It was difficult to support other services on board. And with organ donation, we need teams from across the state and interstate as well to come and help with the process. That was quite difficult with domestic travel being restrained or constrained from those perspectives, and including some tests. Things have eased on from what we were a couple of years ago, and in fact, donation was ceased for patients who were tested positive for COVID same time last year or the year before, and that's all changed now with only lungs and small intestine transplants are not done in COVID positive patients, or are retrieved from COVID positive donors. So that's a lot of information that we've gained, and a lot of research gone into this to provide us with that knowledge, and now we are able to promote and facilitate donation much better than what we did in the last couple of years.
Thank you so much, Dr. Ram. And that follow-up question they have is, what are the key messages? You have many key messages over the years for Donate Life Week, but what are the key messages for this year?
This year, as I said, we're part of the Great Registration Race, and we want people to support organ donation, go out and register your decision on the organ donation registry. There are more than 13 million eligible Australians who are there who've not registered their decision, and that's the key message that we want to provide. 3 taps on the Medicare app, go ahead and register.
Thank you so much, Dr. Ram. We'll go to Dr. Jan with flu messaging. You know, organ and tissue donation is an important message right now, and to try to be as healthy as possible. But Danielle has also mentioned that there are people who are asking that if I'm not well, if I've got diseases, or if I'm vulnerable, should I not be registering? Dr. Jan, any comments on that?
Look, I think the best thing you can do is register. And if the situation happens that a conversation is happening with your family and the doctors involved, they can then have that conversation about whether you're suitable to donate at the time that the terrible thing is happening to you. So I think the key thing is to register. Don't assume that you can't be a donor, because so many people can donate, and it can be, you know, your corneas from your eyes. It's not necessarily something big, but it makes a huge difference to the many, many thousands of people waiting for an organ donation to transform their lives. And it is a transformative thing for those people receiving that organ. It can be the difference between having to have dialysis all the time. It can be the difference between being in hospital. It's a huge difference for those people. So don't make the decision yourself. Wait, get that registration happening, and the conversation can happen at the time between the clinicians who know what's happened to you, who know what organs might be in great condition, might not be in great condition, and talk to your family ahead of time too. I think is really, really important, because sometimes families can get very surprised at the idea that somebody wants to donate their organs. And by actually having had that conversation, giving your family a sense of the purpose behind why you have made that decision, you can really help them process the information they're getting during a very difficult time of their lives and your life.
Thank you so much. And Dr. Jan, probably some of the questions that people might be asking if they've had COVID, it does not matter. They can still register. That's not a case at all.
Absolutely. And again, similarly, not just organ donation, but we also need blood donors coming forward. So if you've recovered from COVID, please do reach out to the Lifeblood blood collection service as well. We need blood. We need all. It's a real thing that with so many people unwell, we need blood donations, and also we need people to continue registering for organ donation and for those conversations to keep happening.
Thank
Dr.
you,
Ram, I
Dr.
think
J.
you had something to say.
No, that's true. Look, it doesn't stop you from registering in the organ donor register. No matter what your health condition is, there's always very strictly scrutinized at the time of donation, and we look at every single aspect of it before donation proceeds. So it's important to register and have the opportunity to create the opportunity to donate. That's the most important thing.
Thank you, Dr. Ram. A question again from SBS. What is Donate Life doing, or Organ and Tissue Donation Service is doing to engage culturally diverse communities in the conversation around organ donation? And we've done a lot of work on this, Danielle.
We have done a lot of work. So Jess and I have worked together over many years, and I think it really is very much a highlight of the work that the Organ and Tissue Donation Service does. We work closely with a range of different diverse communities. We engage with those communities, and we really reach out and ask them what they perceive the issues to be for them, what they need messaging about, and how the best way to get that message into the communities would be. And so of course, for different communities, the messaging and the work that needs to be done is different. For all communities, we look at making sure that we have information translated that is useful, that interpreters are available for families, that I think they're the main things that we do for everyone. Should in the clinical situation at end of life, we always make sure that there's the opportunity to involve a senior faith leader or someone senior from the person's community in any of these conversations, particularly where families are not sure what to do. The Donate Life website also has a number of documents from senior faith and religious leaders indicating their support for organ and tissue donation, and the ways in which each of these groups addresses some of the concerns that community members may have around organ and tissue donation. And then we do work closely with those communities. We've had a number of performance events where we work closely with people who've experienced donation or transplantation to tell their stories, and we encourage community members to ask questions. Jess, you might have something you want to add to that too.
Yes, so we have done a lot of work in terms of approaching it from an arts perspective as well, yes. Doing plays, doing videos. But one of the things that we have done as part of the Organ and Tissue Donation Multicultural campaign, we ran a program called Film Life, which funded young filmmakers to develop videos to raise conversation amongst younger people. And we want to show you one of the films that we had funded, and watch this animation by filmmaker Jin Hien Lau to showcase the message of organ and tissue donation to the younger generation from multicultural backgrounds.
Alvin's world was full of superheroes. He always believed he could save the world. As he grew older, his resolve to help others grew stronger. When he reaches adulthood, his mother Sandra convinces him to give up his dream of becoming a paramedic for a secure job in banking. Giving in to filial piety, Alvin listened to his mother, but deep down, his dream of being a hero lives on. One day, on his way to work, Alvin, in his perfect health, suffers a sudden cardiac arrest brought on by heart arrhythmias. It is on Alvin's deathbed that his mother finds out he is a registered organ donor. with his cornea going to a trauma surgeon and his liver to a firefighter, helping them move onwards in their lives and career. Alvin's heroism truly lives on.
And yes, and that video is available. We'll send you links, but that video is a short version of a longer video, and it's also available and dubbed in multiple languages. And that's just a series, just a few of the videos that is available. But I'd like to just ask this question that people have been asking. When you do register for organ and tissue donation, if you are a donor, and Dr. Ram, jump in. If you are a donor, if you haven't talked to your family, this could be may not be honored by your family in your deathbed. So it is important to have that conversation, isn't it?
Absolutely, Jess. It's important to register and have the conversation. So when you look at statistics, if you register and have spoken to the family, 9 out of 10 families agree for donation. On the other hand, if you've not spoken to the family, but you have registered, then 7 out of 10 families do agree. But in the place where the registration is not done, and we've had a conversation, only 4 out of 10 families agree. So it just drops down significantly. So it's very important to register and have the conversation with the family. Let them know that what your intentions are.
Thank you so much, Dr. Ram. Dr. Jan, we have some questions on COVID-19 and New South Wales Health advice on mask wearing. A few people are asking why, what is the advice of New South Wales Health, and why some people are still not wearing masks?
Look, the New South Wales health advice is very clear. If you're indoors with other people, you should be wearing a mask. And it's so important at the moment to try and limit transmission. Again, the masks work in two ways. It stops you being able to breathe in as many viral particles, and it stops you, if you happen to be infected from COVID, being able to expel those viral particles with any force and any distance. So if you're indoors, and at the moment, look, we've got COVID all around us at the moment, and it is so important that people look after themselves. Our hospitals are under strain and the healthcare professionals are tired. So the more we can do to help protect them and protect the hospitals being available for everyone who needs them, the better. So wearing a mask is not just a thing that should be a matter of personal responsibility. It also shows that you care about the community and you care about other people, and it's a visual demonstration of that care.
Dr. Jan, wearing a mask also protects you not just from COVID, but from other diseases.
That's right. So we've got flu around at the moment. We have RSV. We have all the respiratory viruses are having a good party this winter, I think it's fair to say. And that's possibly, particularly in younger kids, they haven't had a lot of exposure to respiratory illnesses in the last couple of years. And so the younger kids particularly are having a bit of a harder time of things. So please, one of the other key things is, I've talked about COVID boosters, but of course, the flu immunization is still available and is still free for children under the age of 5, adults with chronic health conditions, and of course, people over the age of 65. And it's strongly recommended. And we're not just making a strong recommendation. It is because we are seeing little ones in hospital with flu, adults in hospital with flu, and doing what we can to protect people is so important.
Thank you, Dr. Jan. And please, if you have any questions on COVID and flu and other health issues, please ask the question. Dr. Jan, what is the update on monkeypox? It's in the news these days.
Yeah, so we are still seeing cases being diagnosed here in Australia. We're seeing people, particularly who've gone overseas and have had a bit of a party time sometimes, especially with other people. Men who particularly have sex with men are more likely to be having it. It's a rash mostly. Sometimes people are also getting unwell with symptoms of respiratory illness. it's spread by skin to skin contact. So wearing condoms alone will not protect you necessarily against monkeypox. And that's a really important thing to understand. So if you're having sex with somebody that you don't know and is not your usual partner, then of course condoms are really important in limiting the spread of sexually transmitted disease, but they won't necessarily stop monkeypox. And so that's why it's really important that if you are choosing to have sex with somebody, it's so important that you have that good conversation. Are you well? Have you got any rashes before you dive in?
Mm. Thank you so much for that update, Dr. Jan. And also, one of the key things that we're trying to promote as well is that if you did have COVID, antivirals is available for everyone who does have COVID or are vulnerable.
So antivirals are available for people over the age of 70 with any symptoms, and people over the age of 50 with 2 or more significant medical conditions, so things like heart disease or diabetes, or obesity. And also they're available for anyone over the age of 18 who has significant immunosuppression. So a lot of people who are having treatment for things like rheumatoid arthritis or ulcerative colitis may have significant immunosuppression. Their immune systems don't work properly. So those people, it's so important that if they get the symptoms, to get tested quickly, and if there's any doubt, to get a PCR test, because they're more accurate and they can pick up things earlier than the rats can. It's so important that people then register that test with Service New South Wales and answer the questionnaire that's sent, or that they've got a plan already with their GP. So what we're asking people who may be eligible for antiviral, so people over the age of 70, people over the age of 50 with medical conditions, people who are immunosuppressed, to reach out to their GP and make a plan about how they can access antivirals if they do test positive to COVID-19, so they can get that started as soon as possible. And that, of course, is really important for our transplant patients as well, who hopefully have stayed up to date with their COVID vaccinations, but they are absolutely important. There's also a new antiviral agent that are things called MABs, so monoclonal antibodies. And so that is also being offered to some of our transplant patients to give them some pre-exposure prophylaxis. So we know that people who are very significantly immunosuppressed, now transplant patients can be amongst that group, are less likely to be able to respond to the COVID vaccine. So there's new treatments available. So again, if you've had a transplant, talking to your transplant team who are looking after your ongoing care to see whether you should be having that particular drug. It's 2 injections and it takes not very long, but it can give you up to 3 to 6 months, I think, of protection. So there's lots of things that are available to help people. But the key thing is making sure that if you have somebody that you know and they're having any trouble reaching into a GP, the New South Wales Health COVID flu helpline is there, and they can help you navigate to an appointment with a GP. And people that I know have used that service, because inevitably COVID seems to happen on a weekend when your GP might not be there, and they're able to navigate somebody to find an appointment on the same day, get an electronic prescription often sent to their phone, which a family member, hopefully, or somebody, a friend, somebody who doesn't have COVID, can take to the pharmacy and get your script for the antiviral medication filled. So I think it's that easy. If you're in a rural area and you're having trouble, there's often an arrangement with the local pharmacy. And then again, that 1-800 number can help you navigate that.
Thank you so much, Dr. Jan. We hope that Dr. Dr. Jan and Danielle can stay on for a few minutes, but we've had some more questions here from Tammy. Dr. Jan, is it okay for primary school students to get a COVID or flu shot? This is a question from the Korean community.
Yeah, absolutely. So COVID vaccines for children over the age of 5. We haven't yet got one for under the age of 5 here in Australia, and flu vaccines for any child over the age of 6 months. The COVID vaccines are free for primary school children. The flu vaccines are free for some primary school children who have significant other health conditions. So kids with heart disease, kids with severe asthma, all of those people are eligible for free flu vaccines from their GP.
Thank you so much, Dr. Jan. And Dr. Ram and Danielle, a question when Jan mentioned about children. How old can you become a donor? How old can you start to register?
Well, children, you can only register on the Australian Organ Donor Register from age 16 and above. However, in the case, the very unfortunate case where a child, an infant or a young person may be at end of life, then their family will always be asked. We encourage young people to register. And I mean, if a 16-year-old, families in Australia are always asked. So the registration is one of the steps. The discussion with the families, that other really important step, as Ram highlighted before.
Dr. Ram, would you like to add to that?
Yeah, as Danielle said, 16 and above, you are encouraged to register, and the family certainly would be consulted at the time. And we've had donors as young as infants, so it's in that unfortunate event, the family, the parents would be the people who do the consent and who come up and explore the option of donation.
Thank you. And I guess one of the questions that has come up often from those who have not known about registering or thought that they had registered through through their license, the driver's license. That's always a question, Danielle, that always comes up.
Thanks, Jess, for raising that. I think it's really important to continue to remind people that the New South Wales driver's license registration is not available anymore, that in 2012 we moved to streamline all registration in Australia to the Australian Organ Donor Register. So it's really important that people check, are they registered? Again, that's something very quick people can do by hopping on the Medicare app. And while you're there, if you're not registered, then you can very easily, 1, 2, 3 taps, register your decision to be a donor or not.
Thank you, Danielle. Dr. Ram, how do you, when you talk to patients, as Dr. Jan said, it's important to talk to your GP or doctor about health conditions. Is that what we're also encouraging people to do when they're thinking about donating? Is going to GPs a good decision to go to?
So I talk about donation whenever there's an opportunity. So it's not something that comes up very often, but it's important to stay healthy as you need to lead a healthy life. And donation only happens in those unfortunate circumstances where they're not able to live anymore. And at those instances, when your intentions or when your decisions known to your family, it makes a huge difference, and donation then progresses and happens safely and in a nice way.
Thank you, Dr. Ram. We've run out of time, but any last messages for the media online today, and what you'd like to remind them to broadcast to their audiences?
As we've been saying all this session, it's Donate Life Week, and please register and make sure your family and your close family and friends are aware of your decision about registration. It's easy, 1, 2, 3 tap, and your Medicare app, you can register.
Thank you so much, Ram, Dr. Ram. And also there are resources available in languages for people to access.
Yes, there are resources available in language. So if you've got questions, please visit the Donate Life website, donatelife.gov.au. You can also register your decision with one click through the Donate Life website, but there are lots of resources there for culturally and linguistically diverse groups, statements from religious and faith leaders, but also resources in language that will answer some of the questions or many of the questions that people have. And if people find that there's a question that there isn't an answer to, then use the web contact forms to send an inquiry, and we will get back to you with a response.
Thank you so much, Danielle, for joining us here in the studio. And Dr. Jan, any last words, just reminding everyone to keep safe?
Look, and I think that's the thing. COVID is out and about with us at the moment, having had COVID even as few as 4 weeks ago, doesn't mean that you've got good protection against what's circulating at the moment. So please don't get complacent. Help keep each other safe, set a great example to each other, be kind to each other, and please keep those vaccinations going, keep the boosters going, get tested. And if you're sick, please, please, please stay home and keep your germs to yourself.
Thank you, Dr. Jan. And you'd be pleased to note, I got my booster on Sunday, my 4th booster. So I get a thumbs up from Dr. Jan. So thank you so much for joining us. We want to thank Dr. Ram and Danielle for joining us. And as always, Dr. Jan, thank you for all your updates and your tips for us. I'm Jesusa Helaratne. We want to thank you always for joining us for this Multicultural Media online sessions. As you've seen, there are links to the resources for Donate Life Week, as well as for COVID-19 resources. We'll send them through with a recording.